He's a hero in the health insurance space, founder and principal broker for healthinsurancementors.com. The open enrollment period has started started today.
Started today.
And, of course, you've got competing visions for health insurance going forward that will inform, I suspect, a lot of votes in 2020. The $20.5 trillion Elizabeth Warren Medicare for All plan, no private health insurance, as one example. And then this plan that's been unveiled by House Republicans, spearheaded by Republican Study Committee Chairman Mike Johnson, who's a congressman from Louisiana, that does a number of things that one C.S. Tucker, who is an expert in the space, the first man to ever read the Obamacare legislation and to read it the fastest in recorded history.
It was an easy beach read for him.
He is calling this new RSC plan that I've referenced, the Mike Johnson plan, the best healthcare plan I have ever read. Those are big statements. That's Lori Lightfoot sort of tough talk. C.S. Tucker, thanks for joining us. Appreciate it.
Good morning, Dan and Amy.
Good morning. This best healthcare plan you've ever read, a couple of the things that caught my attention featured in this plan from House Republicans, because this is where Republicans have been attacked: extend HIPAA portability and pre-existing condition protections with employer-sponsored insurance to people in the individual marketplace, and also establish federally funded, state-administered guaranteed coverage pools to ensure individuals with high-cost illnesses have access to quality and affordable coverage, including that their coverage dynamics cannot change if they get ill, if they develop a new illness while they're under a current plan.
Yes, I can't believe it's been a decade, but a decade ago, I stood on a stage on a freakishly warm 74-degree day in Daley Plaza for the 2010 Chicago Tax Day Tea Party. And during that speech, I said, all you need is one sentence to fix the American healthcare system when it pertains to individual health insurance. And that is simply extend HIPAA portability protections to individual policies. Done. Not 2,400 pages, not a complete overhaul of the American healthcare system. Just provide the same protections you have in the employer-sponsored market against pre-existing conditions to the individual marketplace. And believe it or not, it takes very few things to get me excited. These guys actually did it.
Well, it takes about 10 years for them to know what extend HIPAA portability means, actually. So that's about on schedule.
Exactly right. So there are two catastrophic failures with the ACA, Obamacare. The first was taking everyone who has the highest cost medical conditions and lumping them in with everyone else who does not have high cost medical conditions. And all that did was raise premiums for everybody else, right? As high as 260% increases in the individual marketplace. Then they also implemented medical loss ratios, which wiped out 88 health insurance companies in this nation, 17 of them gone from Illinois, and every single one of them gone from the state of Indiana, except for one, Ambetter, if you are unlucky enough to have to buy your own individual health insurance. So this plan fixes that. Then, the most immoral provision of Obamacare was providing a massive expansion of Medicaid to those who are not disabled, who are not single mothers, and children of the poor. Medicaid was designed as a safety net. Obamacare created a hammock for anyone with a pulse and less than 138% of the federal poverty level, which equates to $17,236 this year. And then what it did for those new Medicaid recipients is provide their providers who treat them a 90% reimbursement ratio compared to the 50% reimbursement ratio that legacy Medicaid recipients get. So there was a perverse incentive for providers to treat the new Medicaid recipients who, again,
at the
are
expense
not
of
disabled.
The old ones. Yes, right.
At the expense of the old ones.
Qualified under the old strictures that you were talking about, right.
That's exactly right. And so that increased Medicaid wait lists exponentially since the expansion of Medicaid. And again, for those who cannot help themselves. Many of the people who are new Medicaid recipients currently, they're not disabled. They can help themselves, and they're getting a higher rate of reimbursement. So it's a perverse incentive to treat those people, and it really disenfranchises those who can't help themselves. So that's it. Now, in addition to those two major corrections. We can finally have a health savings account that's allowed to be funded as high as the massive Obamacare deductibles. As you know, as of January 1, everyone who buys an Obamacare individual plan will have $8,150 out of pocket. I don't care if you buy a bronze, silver, or gold plan. I don't care how low your deductible is. You're going to be exposed to $8,150 per person times 2. So we can now put into our health savings accounts, if God willing this goes through, $18,000 into a health savings account, which is tax-free. And then we can use that money for the first time since I've been calling for it to pay for health insurance premiums. So what do we do there? We equalize the current unequal treatment between employer-sponsored health insurance and individual health insurance. These are simple, brilliant, common-sense solutions. And then we go a step further, and we codify President Trump's attempt to create association health plans. He did it by executive order in an attempt to change ERISA law. The lower court struck it down. But until they did strike it down, we had the Iowa Farm Bureau creating one of our nation's first association health plans in Iowa and Nebraska. People were enrolling. They had protections for pre-existing conditions. Their premiums were lower. Things were great. And then, of course, the resistors stopped it. So this codifies that into law. So we can create association health plans so people can group together and, of course, enjoy lower premiums and protections for pre-existing conditions. And then lastly, we reinstate how HIPAA law worked before Obamacare. As you know, 45 states in our union, long before anyone ever heard of Barack Obama, had state-based risk mitigation systems for people who were denied health insurance in the individual marketplace. But those rules were smarter than the ACA because they required a person to keep consistent health insurance coverage in place, not wait till you're sick, never have health insurance, and then jump on the exchanges and drive up costs for everybody else because now you're sick. It requires you to keep at least 12 months of prior coverage in place, in force, so that the insurance companies can build up the necessary reserves to actually pay claims. It's the same principle as if you bought car insurance, but you were able to buy it after you wrecked your Maserati. It does not work. You have to buy car insurance before you wreck your Maserati. So health insurance will now once again work that way. If you have 12 months of prior coverage, all your pre-existing conditions will be covered from day one when you move from a group plan to another group plan, and now from an individual plan to another individual plan. And so if you don't have 12 months, you've only got 8 months, then you wait 4 months until your pre-existing conditions are covered. If you have 9 months of prior coverage, then you wait 3 months until your pre-existing conditions are covered. And that provides a strong impetus for people to stay in the health insurance marketplace so the insurance companies can build up the necessary reserves to actually pay claims.
And one other feature that you mentioned here, and this relates to people that have a gap in employment, may have to elect Cobra. You point out that this Republican plan would allow individuals to elect Cobra and then move to an individual plan without having to exhaust Cobra first.
Yes. Do you know how that's one of the Obamacare loopholes? It's a horrible situation. Somebody elects Cobra. It's, as you know, it's more than their mortgage payment to elect Cobra, but they want to elect Cobra and have to here in wonderful Chicagoland because you can't use an individual plan at Northwestern, University of Chicago, Rush, or take your sick child to Lurie Children's Hospital. So they try to swing these Cobra premiums. 2 months later, they realize they can't afford a second mortgage payment to pay for Cobra, and they can't buy an individual plan until January 1. So now, under the RSC health plan, you can leave your Cobra and go to an individual plan at any time and be protected against pre-existing conditions. This is common sense stuff.
Amy's sold.
I'm sold. I just listened to you talk. Like, that makes so much sense. But why are no lawmakers listening to you?
Well, some lawmakers are. This is the Republican Study Committee's plan. The question is, does it go anywhere, even if Trump is reelected, until you take the speaker's gavel away from Nancy Pelosi? And the answer to that is probably not, right, Stephen?
Probably not. But, look what's happening right now with Obamacare fully in place. There are left-wing states, blue states like Alaska, Maine, Maryland, Minnesota, New Jersey, Oregon, Wisconsin, that are filing 1332 waivers to get out of Obamacare to create their own state-based risk mitigation systems. Alaska did it. They were expecting a 40% increase. They got an increase of only 7% on their annual renewals. Hawaii, Maine, Maryland, Minnesota, Oregon, they're all escaping from Obamacare. If it's so great, why are they escaping from it?
Now, Democrats, I want to get your reaction to this little bit of theater that they pursued on the Senate side, not related to impeachment this week, shocking, but it was a resolution Democrats framed as a measure to reverse Trump administration efforts to undo these protections for people with pre-existing conditions. Patty Murray saying, we've been trying to put them on the record because all their actions with respect to people with pre-existing conditions go the other way, away from protection. They have criticized the waivers the Trump administration put out a year ago, which you were just talking about, especially the option of applying to have federal subsidies go to people who buy health insurance plans that don't cover pre-existing conditions.
Yes, right. Well, those are the short-term health plans now. As you know, I went to Springfield earlier this year to try to stop the Illinois Democrats from shrinking short-term plans down from 12 months, as they were restored under President Trump, to 6 months. And everyone within the sound of my voice needs to understand short-term health insurance plans in the state of Illinois are now dangerous for anyone to purchase because they only last for 6 months. So you buy that January 1, by the end of June, it's going to end. And if you're sick or injured, you will not be able to buy health insurance for another 6 months, which is a lifetime if that's a cancer diagnosis. So do not participate in these plans in the state of Illinois. They are extremely dangerous.
All right. He is C.S. Tucker. He's the founder and principal broker for healthinsurancementors.com. And as you can now understand, he is a hero to both Amy and me.
Right.
Yes. C.S. Tucker, thank you so much for joining us. Appreciate it.
And
Thank you, guys.
he joined us on our turnkey.pro answer line.
Before you see it on TV, share it on Facebook, or read about it in the paper, hear it here first. This is Chicago's Morning Answer on AM 560. The Answer.
Scoundrels are not exclusive to politics. They're smart enough to occupy necessity service industries like the automotive business. As a real estate broker, my car is a lifeline and a total necessity to my business and my family, which is why I had to seek out an honest, truthful auto service provider. For over the past decade, I've put my trust in Craigies Mobile Service Center on Lake Street in Addison. Craigies handles full auto repair on